My name is Anna Hyde. I am the Vice President of Advocacy and Access for the Arthritis Foundation. We represent the 54 million Americans living with arthritis in the United States, which comprises over 100 different diseases because arthritis is really just an umbrella topic. So what we do is we provide a lot of resources. We are a trusted go-to source for patients who are looking for any kind of information about their disease, treatment options, things like that. For the Arthritis Foundation, innovation is important because arthritis is a lifelong disease. When you are diagnosed with the disease, it can be a very scary diagnosis. And the first thing that you want to do is know what is going to help you live your best life. And oftentimes that means biologic medications, it means access to pain treatment. Unfortunately, sometimes it means access to surgery and medical devices that are going to help you live better. But because it's a chronic disease that can be degenerative, access to and better innovation in medication, better biologic medications, better medications across the board that have less side effects, that are going to just allow patients to have a higher quality of life. For autoimmune forms of arthritis, and particularly rheumatoid arthritis is one that people tend to be most familiar with. The advent of biologic disease-modifying anti-rheumatic drugs has been absolutely revolutionary. And so there are stories of what waiting rooms, for example, looked like in doctors' offices, where you would often hear described as a sea of wheelchairs. And then after biologic medications became common for treating RA, you rarely see that anymore. Juvenile arthritis can be particularly a cruel form of the disease. Kids who get arthritis, it tends to be, it's a systemic disease, so it impacts organ systems and other things like that. It's not uncommon to talk to people who were diagnosed with arthritis before biologic medications, who underwent multiple joint replacement surgeries, hospitalizations, severe infections, things like that, before they even turned 20. Now, that still happens, unfortunately, but it's much less common. So it's been really revolutionary for our children. Our concern is that if there's not further innovation in the treatment of arthritis, that patients will continue to experience high and oftentimes debilitating levels of pain. And it's something that they'll have to face for the rest of their lives. That even patients who are on these revolutionary drugs like biologic medications will experience severe side effects, or that they'll get to a point where they've cycled through all of the biologic medications indicated for their disease and there will be no options left for them. Unfortunately, we've seen patients who are at that point, and it is heartbreaking. We don't have a disease-modifying drug for osteoarthritis, which impacts more than 27 million Americans, and it's the leading cause of disability in the country. And the best we can offer is, on the front end, pain medication, NSAIDs, things like that that you buy over the counter. Alternative therapies work for some people, physical therapy, acupuncture, things like that. But there aren't any real options for people with OA. Identifying better treatments for pain is certainly an area that we'd love to see more innovation, and there have certainly been a lot of research efforts in this vein. So that's something that we're hoping for in the next 10 to 20 years. Another one is around precision medicine for rheumatoid arthritis. This is a burgeoning field. Certainly precision medicine is something that you hear in a lot of therapeutic areas now. But for rheumatoid arthritis, there is a genetic component to the disease. And being able to identify what therapy is going to work best in you is something that could potentially be transformative. Because right now, if you come in as a newly diagnosed patient with rheumatoid arthritis, it's really trial and error what drug to start you on. There are multiple classes of drugs for RA now, which is great. There are options, but knowing which one's going to work best for you is really an art form. And what we found, and broader literature supports this, is that patients often have to cycle through 2 to 3 drugs before they find one that does work for them. So we're looking for a real holistic approach to treating the patient, which we think has a benefit to all players in the healthcare system. It'll drive down costs over time because you're then avoiding unnecessary surgeries, hospitalizations, worsening disease that's going to lead to more expensive treatments and things like that. And of course, our ultimate goal is that it leads to better health outcomes and better quality of life for the patient.